Hi guys, it's Dr. Galante. I get asked all the time, can you help me after I had surgery? I had back surgery, neck surgery 6 months ago, 2 years ago, 10 years ago, and I'm still in pain. Can you help me? And the answer to that was answered very clearly in the recent study. But a couple things first. There's all different types of back surgeries, as you can imagine. The one that gives people the most problems long term is the fusion surgery. So with a fusion, what they do is they fuse vertebrae together. So they'll put a plate and a screw in those vertebrae to stabilize those vertebrae so they don't move anymore. And when they don't move, it doesn't hurt as much. The problem with that surgery is all the stress that goes here now goes right here. So when they're talking about the lumbar spine, you have 75% of the stress at the bottom disc. If that's fused, you have 75% of the stress moving up a level. And it's just going to be a matter of time, usually it's between 3 to 5 years before that disc above is having problems. So the problem, can we help that? Well, the short answer is yes. But a qualified yes. There's only certain techniques that I would do on patients who have had post-surgical necks. And the main technique I would use would be something called the Cox technique. I was fortunate enough to be part of a study, a national study, where we studied this. We took patients in that had spinal surgery, still having problems. We treated them, and then they tracked them over 18 months, I believe it was. And the outcomes were excellent. Now, remember, when we're talking about a chronic back condition, post-surgical back condition, if you get people 30% better, you're doing good. If you can get to 50%, that's great. And if you can get anything above 50%, that's just a bonus. So, when we participated in this study, the conclusion of the study was greater than 50% pain relief following Cox technique was seen in 81% of post-surgical patients over a 49-day period of active care. So if you or a loved one had spinal surgery and are still suffering, there is hope and you do have options. So let's see if we can help you. Thanks and be well.